Hello and welcome to Crushing Doubts Q&A. Every week, Mondays, 6 p.m. Eastern, 3 p.m. Pacific. It's great to be back with you. I want to wish you all a happy new year. I'm very excited about this year. I think a lot of great things can come for us all. I'm looking forward to getting as many of you help with your mind-body issues as needed, and I know there are millions. So let's get this done. We can start to talk about what we can do about all of these things. As always, we're going to talk about how to work in each of the columns, how to understand your moments, how to think through what is going on for you. And I do want to just remind everyone out there that there are several ways to access the work. The seminars we do pretty much every 6 weeks or so. There should be one coming up in early February. We're going to announce the date shortly. But in the meantime, you can always watch the videos from previous ones if you need to get the seminar now. What the seminars do is they give you the basic information that you need to know about the whole column system. And the way I think about it is it actually shrinks the entire mind-body community information into 8 compact sessions about what you need to know. So the seminars are very helpful with that. The group memberships, in the meantime, can be set up in a way where you can come once, twice, or 3 times a week and have meetings where we discuss on Zoom calls directly live about your moments, where you might say to me, okay, well, this happened. How would I think about this? How do I think about this in terms of the columns? So those are 2 of the main resources I'm now using. In addition, I'm very excited about this. We've got a bunch of stuff coming up in 2022, so I'm just letting you know the announcements first. I did finish the rough draft of my book over this vacation. It was very exciting. I wrote 3 chapters in 12 days. It was madness, but it happened. And now I'm working on the editing. I'm already a 5th through the editing, so we're making very good progress. I'm hoping to have that book out to you in the spring, maybe even earlier. I'm going to keep you up to date on announcements about that. One last announcement, and I do want to say hi to everybody. We've got a lot of people saying hi. So we've got Michelle, Jimmy Drack, we've got Sarah Fire, who's actually Maureen, Catherine Toomer, Sue Conte, I see you too. Happy New Year, Maureen. Good to see you. Lucy Oden has joined us. Scotty Styles says hello. That's all on Instagram. Dorisa, good to see you on YouTube. This is also available on Facebook, so please bring your questions. We do have some preloaded ones. But one last announcement about 2022, and that is that the content of Crushing Doubt is going to shift from the YouTube platform soon. And I need to let you know how so that you don't miss it. We are going to be switching to something that is an organization that I'm actually part of. It's called the Spark Network. This is going to be a new streaming network. And that means we can control where the content is going to be. All the content that's already on there is going to stay on YouTube. So you can certainly access that. For new content coming up in February, I'm going to keep letting you know how you can access that. It's not going to be hard to do. And I'll just keep you posted on that. You'll probably first hear about it on the newsletter if you're part of that. But I'll tell you about it on virtually all the content, just so you have a sense of when that's coming. I will keep you posted. Okay. We have a question coming in from Instagram. Oh, we have a comment also from YouTube. Patty Martin says, hi, Dan. It was a great group session today. I totally agree, Patty. Really, really, we're having great interactions. And it feels like a community where we really all help each other. I get a lot of help from you guys as well, and I appreciate it. Okay, Maureen's question from Instagram. Do you ever recommend tabling when you are in freeze mode? And if so, what's a good technique to do that, or positive thought to not get stuck on the which column? Okay, Maureen, really interesting you say this, because I continue to tweak and to hone my system. And one of the things that I've honed just fairly recently, I keep bringing trauma more into the picture to understand how do you deal with it. And I've now taken to saying this. When you are trying to figure out which column you're working in, there's a step even before the columns. Although I'm starting to consider it as part of the column structure. So the way to think about it is the very first step you're going to take is to assess whether you are in trauma or not. Because if you are in trauma, you cannot use the columns in quite the same way. I'm altering how I'm saying this because I'm understanding more and more about it. It's not that you're not using the columns. It's that the trauma work is part of the columns, but it's the part that comes before you can even assess which column to zero in on. So it's a more broad focused view. Am I in trauma or not? That being said, you could argue that this is jumping right into the power column, because when you are in trauma, that's when you have zero power. your power has been reduced to zero. Your doubts are through the roof. Everything is as bad as it could be, and your emotions column is as activated as possible. So all three columns are going crazy when it comes to trauma. Freeze mode is referring to a thing that goes on in trauma where you literally freeze. It's like a deer in headlights. You don't know how to operate. So what I want to say to you, Maureen, is yes, you want to take a step back and not yet do the columns work. You want to be nurturing towards that trauma part of you and get fiercely in your own corner. I guess in a way you are doing power column work there, but it's a special kind of power column work that's much more nurturing. It's much more kind of bare bones interaction with yourself about it. And that's kind of how I would think about it. What you want to do is get really kind to yourself and recognize that, if you have trauma, it means somebody taught you to not be kind to yourself right from the start. And you've got to catch yourself in those moments and decide, you know what? I don't deserve that. I'm not saying this is easy to do or it just happens right away, but that's how you want to start working with it. So Maureen, let me know if that makes sense to you. She said right on, freeze for protection is what she was referring to. Absolutely. So let me know, Maureen, if that answers your question. Okay, Karen Isaac says, Happy New Year. There was a mind-body show on PBS. I wrote in and mentioned your work as I do everywhere. I want the world to know this work. Hey, thanks, Karen. That is, first of all, that's very kind of you to do. I'm excited about people getting more information on this. The book coming out, the streaming network that's coming out, is going to spread the word much far and more wide, and that's what we want. And really, we all want this for the whole mind-body community. So I think it's great to be pushing for this, and I really appreciate when people do that. I know, it's not easy to put yourself out on a limb and go ahead and say something, but Karen, you are a great advocate. I see you on Instagram and many other places saying, hey, check this out. And I know you include me, and I really appreciate that. Okay, Positively Whitney has joined. Hi, she says, hello. Good to see you. So Maureen, you said, yes, brings in tears. So it sounds like it really does make sense what I'm saying. And listen, when you've been in trauma and then people do identify with it and empathize with you, trauma victims are not used to that. And it really feels great. It feels great that we can do it for each other. And that's part of what goes on in the group. I think that's part of why Patty was saying it was such a great group session today. We did a lot of that today. It was really important. Okay. Molly Miniatures, good to see you here. But she says, my doubt is kicking in badly now. I got this headache 2 days ago with stomach crampy. I will spare you the details. Thank you, Molly. And I'm sorry. But the stomach better some, however. I'm feeling like Jack from Nightmare Before Christmas with my brain saying, what's this? What's this? You know what's interesting, Molly? I've never seen Nightmare Before Christmas. I've been meaning, it's been on my list. I can't believe I haven't seen it. I don't know how it happened. It just happens sometimes. But let's dive in here, Molly, about your doubt. First of all, I want you to remember that you have conquered doubt before. The burning mouth as an example. That was a very important beating back of doubt that actually has helped many other people. And people have said it to me. Wow, I can't believe that happened. It's helped them to feel that they can do this. So now let's look at what's happening specifically in this doubt. And then Catherine, I see you on Instagram, and Whitney, I see you have a question too, and Napoleon on YouTube. So I'll get to all of it. But Molly, let's think about why the doubt is kicking in the way that it is. First things first. I know doubt has kicked in, but you're still close enough to the onset of the symptom to, I think, focus in on the emotions column work. You got a headache 2 days ago with your stomach crampy as well. I want you to think about what was going on then. Now, I don't know what the timing was, but that was New Year's, it sounds like. So try to think in specific first about the emotions column, because sometimes you resolve one of the columns by getting to the column that was primary first. And the emotions column came in here first. So maybe think a little bit about that. Now, Molly adds, my brain goes to, oh no, I have something really bad and it is going to ruin me and my life. Totally get it. And so it's probably true that the doubt column is going to be your dominant column. I just got through saying this in the groups today. When the doubt is activated, it is the dominant force. It probably has already taken over for whatever was going on for you emotionally. But you could use the emotion column information to come back and fight the doubt. In the meantime, we also have to ask the question, this is similar to what Maureen was saying and I was talking about. And this is interesting. So Molly said, I ate too much raw broccoli, is what my husband told me. And yeah, he could be right. All right. I have my doubts, I got to say. I don't mean to pry in here, but part of my role is to bring in battle against doubt. And to me, that sounds more like a trigger and something that would be used to plausibly explain this. And I really don't think so. Mind-body stuff always makes sense. I can't believe how many times I've gone through it and thought, oh, it's probably not going to make sense this time. Every single time it does. So, Molly, I'm just going to tell you, I'm almost 100% certain that there was something emotional going on right then. If you look at the timing, it's going to help you with that. It'll bring down your doubt to make sense of it. When it doesn't make sense, that's when we go flying all over the place and we say, oh, what's this? What's this? What's this? You can conquer this doubt. Let's work on the one assumption I ask you guys to make is that this makes sense. You make sense and your symptoms make sense. And I totally get you on the stomach stuff, of course, Molly. I'm going to read some of her observations, then I'm going to jump back to Catherine on Instagram and then Napoleon on YouTube, and I will keep right on going. Whitney, I'll be with you in a second too. So Molly said, but my mind goes to, I have an incurable disease. Yeah, I know, stupid. Listen, there is no stupid. It's only about how your mind works. Just note it. We know that your mind does this, and we know it's basically never been right. So this is good. Now, she said, when I get stomach stuff, I get triggered and then get a headache. That's interesting. I actually have it the opposite, which is when I get a headache, I get worried it's going to become stomach stuff. And then sometimes it kind of minorly does. Really, and some of that comes from how much people talk about concussions and how they lead to throwing up all the time. Do you know what? I don't think that used to be the case. I'm not sure, but I never used to hear about it, ever. I did not hear, oh, concussions always make you throw up. Well, people started talking about it, and then it started happening. I'm not sure that that's true, but I'm pretty sure based on what I've heard. We should look into that. What I do know is this. The things that get said in society or get said by our significant others, they become triggers. So that broccoli thing, that's a trigger. Or the concussion thing for me, that's a trigger. Over and over and over, there are triggers. In fact, this is an observation I've made with respect to my phobia. I cannot tell you how many TV shows and movies have people throwing up in it. It's as if people think it happens like once every 2.5 days. And it drives me crazy because of my phobia, of course. But it's also interesting because what it is societal aggression getting taken out in these unconscious ways that are just, people accept them. We got to not accept these triggers. We got to work at it. Molly, I want you to jump back and think about what was going on emotionally to use it against doubt. Let's start there. Okay, we had a question from Catherine to plantar fasciitis, which has improved. That's great. So Catherine says, my plantar fasciitis has improved, lots of variability. My mind has brought back the nausea and ramped it up. Oh, you know I won't like that. Somehow, even though I'm in more pain, I sense that I'm getting closer to solving this. Makes sense? I think I need power. Catherine, yes, not only does it make sense, but I think you are right on. I think when people are getting close to power, the symptoms tend to get the most activated of all. That is the time period when it is the most active. Unless they've had a chronic symptom that hasn't moved at all, then that chronicity in the doubt column can be very powerful and stay there. But once people start moving towards power, doubt doesn't like it. And listen, I'm going to call a spade here too. A lot of people in your life aren't going to like it. People who are ostensibly supposed to support you, but actually don't that much. And that's the scary thing about the power column. It reveals who everyone is. So the stakes couldn't be higher. And yet, the good news is nothing bad can happen because you're only revealing the truth. If you can just be open to revealing the truth, you're going to be fine anyway. Because anybody who is standing in the way of your power needs to be removed from the equation. They shouldn't be playing a major role. So, Catherine, I'm pretty sure this is part of what's going on for you. I'm more than pretty sure. I'm completely sure. I got to remember my own language, no doubt. We got rid of your plantar fasciitis, and now other things are happening. Well, this is doubt grasping at straws, looking for angles to hang on because you are about to kill it off. I talked about this in one of the group meetings, actually. Becoming powerful is like fighting an internal revolution. You get to make your choices. And you get to decide, I'm not putting up with this anymore. I'm not living this way anymore. It is a revolution. And it's scary. It absolutely is. It makes sense that it's scary for you. It was very scary for me. But I will tell you, on the other side of it, I feel much better. All right. Napoleon says, hi, Dan. Happy New Year. Happy New Year, Napoleon. I'm doing better. That's great. Some mind-body symptoms that come and go and replace between them, but I'm getting better. That's fantastic. So this, Napoleon, you're a good example of this. Somebody who has interacted with me at various points and brought up certain doubts, and we just kept working the system. We kept working at it. And that's the thing that's great about the columns. It's a system that truly works, but it also gives you ideas and steps to move forward. And that's what happened for Napoleon. He kept working at that system to understand it, and he's getting it together in his own way, much of which I don't even know. You build your system within my system, and I understand it isn't always going to work for everybody right away, but my system is designed to work for everybody. The only people it doesn't work for are the people who eventually lose their battle to doubt at some point. And some of them even come back later and say, oh, I realized I lost my battle to doubt there for a bit of it. I got to get back to it. So all you have to do is make sure doubt doesn't win and keep moving towards power. Keep working in the columns. Thanks for sharing that success, Napoleon. I'm so thrilled to hear it, and it will be a much happier New Year for you. Now, Dorissa's echoing Molly's, Molly didn't recommend watching Night Before Christmas, but Nightmare Before Christmas, Dorissa's saying is a good watch, so I'm going to get to that very soon. I want to make a couple of observations about something Molly said, and then I'll get back to some Instagram questions. Molly said, and this is to Catherine Toomer from Instagram, the plantar fasciitis I had, and it's totally gone for over a year now. Plantar fasciitis is one of these, this is one of the observations I want to make. Plantar fasciitis is one of the in vogue ideas. Sarno talked about this, and at the time, back pain was the most in vogue. It's still very much in vogue, but the two that are most in vogue that I've seen are pelvic floor pain and plantar fasciitis. They are all the rage, as we say in the TMS community from the Michael Galinsky movie, which is a great movie, by the way. Check it out. Now, Molly says, I think the gas pains triggered me to a point that was out of proportion to the discomfort. So it makes sense. Listen, any of these symptoms, anything can be a trigger. And we need to keep a lookout for it, because doubt is going to try to attach to triggers and go with it and run with it. And these are good things to observe, Molly. Listen, just by having these conversations, you are going to start to have an easier time with this. There was a question, what is pelvic floor pain? So it's pain in the pelvic area that usually relates to sitting down. People have trouble with that motion or that way of being, the pressure that it puts on it. They just have pain in their pelvic area from that. And the fact is, it is just another garbage term that is a mind-body term. And I've cured it directly, specifically many times, just as I have with plantar fasciitis. So, okay, I will get back to more YouTube questions, but first we have a couple of questions on Instagram. Okay, Whitney. I have a question about SSRI withdrawal and benzo withdrawal, real or TMS. Thoughts? Okay. Great question, Whitney. So this is interesting because SSRI withdrawal versus benzo withdrawal are actually very different. From what I know, first of all, benzo withdrawals can be very dangerous from a physical standpoint. So from a medical standpoint, I would say with benzos, definitely consult with a medical doctor about that. With SSRI withdrawal, I would still consult with a psychiatrist, a medical doctor, but that's not as actually dangerous. And a lot of SSRI withdrawal I have found is mind body, a lot more. In fact, I've even gone through it myself. I never wanted to get on SSRIs, and when I was working with the hated therapist that I talk about sometimes, I was having a lot of anxiety. Now, I was having a lot of anxiety, ironically, in relation to him and a patient I was working with is causing a lot of anxiety, which that very, very rarely happens. Usually I have great interactions with people, but it can happen. And eventually I had so much anxiety that I went ahead and got on an SSRI, and it did help at a certain point, because what is it doing? It's basically numbing you. And that can be helpful at times. Don't get me wrong. I kind of needed it. But when it was time to get off of it, and I so wanted to get off of it because I didn't like the association with this particular therapist, I was so worried about withdrawals. And guess what I was worried about primarily? You guys know me. I was worried about my phobia. Everything else, I was like, fine. People talked about the popping and electrical sensations. I was like, I'll deal with any of that. That's fine. Now, I say that, but I didn't have it, so I'm not saying it's not a big deal. But the phobia was the main thing on my mind. Well, as I started to do it, every time I would try, I would get symptoms, and they were kind of nausea related, because that's what I was afraid of. The way I think about it is SSRI withdrawal, if you do it slowly, if you're tapering off, you shouldn't have any real symptoms that aren't mind body. If you do it all at once, you very well could. So follow a doctor's prescription, take it slow, but know that there are going to be mind-body issues involved with that. Benzo withdrawal probably has some mind-body things too, but it also is incredibly medically dangerous. So take it very slowly. With SSRIs, I recommend taking it slowly also, but know that almost all of it is mind-body if you're taking it even remotely slowly. Okay, hope that helps. Let me know, Whitney. Okay, Maureen has a question. Can you state again when in trauma? If it means early on you were taught not to be kind to yourself, or would you also say that someone taught you not to be fiercely in your own corner? So that's a great question, Maureen. Here's what I'd say about it. Trauma taught you to not be kind to yourself. Trauma doesn't mean to me, it doesn't mean to me that someone didn't teach me to be fiercely in my own corner, because guess what? In our society, I find no one teaches us to be fiercely in our own corner. It's crazy what we are taught, but we aren't taught that, generally speaking. We don't talk to our kids in ways where we say, I guess we do it in a couple of ways. Like one, with sexual abuse. Sometimes we do talk about it in that way, where we say, no one has a right to touch your body without your permission. That's being fiercely in your own corner, that kind of statement. But how often do we really say that kind of thing? We do say it about sexual abuse, and that is as it should be, and it's good. But do we say it about when somebody tries to humiliate us? Or do we say it when we love something and someone insults something that we love? We should be fiercely in our own corner about everything. Now, does that mean we should live that out loud and go cause a fight with everybody all the time? Of course not. I'm not for fighting. I generally don't want to do that. But within myself, I wish somebody had taught me to be fiercely in my own corner. The very first person who ever taught me to be fiercely in my own corner at all is Dr. Sarno. And this is why I love the man. Aside from the fact that he got rid of my symptoms in large measure and is brilliant and saved so many people, one of my favorite things about Dr. Sarno is that his books taught me to be fiercely in my own corner, to really care about me. And I want to thank you again, Dr. Sarno, even though I know that you're not with us on this earthly plane. You did that for me, and I love you for it. So we have to have people teaching us to be fiercely in our own corner. So I don't think we're taught not to be fiercely in our own corner, but I actually think it's the opposite. I think we're not even taught to be in our own corner, and that's actually in some ways an even bigger problem. Okay. Dorisa from YouTube said, want to hold on a second. Okay. Oh, she said, I want you to know I'm doing much better. Okay, good. Got scrambled a little bit. Went on vacation, was able to do short hikes and get up early. Still can't get rid of my hemorrhoids issues. Well, listen, this is interesting. This is another one that shocked me when I was working through what kind of mind-body issues can be fixed. Hemorrhoids, things like anal fissures, these can actually be cured with mind-body work. And why is that? Because when you're tense, the skin is taut, and it leads to these things. It actually leads to these irritations. This, again, shocked me, but I have directly cured that myself with other people as well. So that can happen. But Dorisa, I'm really glad to hear you are continuing to get better and better. I used to get to interact with Dorisa more with the Facebook groups, but Dorisa, if you ever need my help, you know where to find me. But you are doing better, and that is fantastic. Okay. Back to Instagram. Whitney says, I've been dealing with POTS syndrome, which I believe is TMS. It is, for sure. But also coming off SSRI and benzo meds and have gotten very sick and bedridden. Hard to tell what is what because so much overlaps. Okay, sorry, that was a follow-up, Whitney. I didn't realize that was there, and I answered a lot of the questions before, but I'm gonna answer it again, especially now that I know you are specifically going through that. Listen, even with benzo withdrawal, you can get there. Just take it really slowly. If you take it really slowly, what that does, especially with medical supervision, what that does is it gives you a chance now to attack the mind-body issues. Because you are tapering slowly, nothing medical is going to happen. And you say hard to tell what is what because there's so much overlap. 100%. One of the hardest things I ever did was getting off of this SSRI. And I had heard that it was very hard for some people. And then I had heard from other people, oh, it's really easy. That didn't make sense to me. Then I heard people say, oh, you can get very sick from that. Then I talked to the idiot therapist I was working with, and he was like, no, I've never heard of that. What is going on here? How are we supposed to make sense of these things when we're getting opposite descriptions from other people? Well, the one way we can make sense of it is that there's a medical side of things and there's a mind-body side of things. If we take the medical side conservatively, we taper off the meds slowly, and we listen to our doctors about just that aspect, about what can make us really not do well. Great. Otherwise, it's all mind-body, 100%. But it's a very, very powerful trigger, Whitney. I've been through it with the SSRIs, and I can imagine. But I want you to just be responsible with the medical side, take the tapering slowly, and after that, attack the TMS. Attack the mind-body stuff. And let me know if I can be of help, because I'm sure I can be. Catherine Toomer said, thanks for the affirmation. I'm going with it. Great. Glad to hear it. Now, Maureen said, or lost to power. I think that was when I was referring to battling doubt, and I was saying you lost your battle to doubt. So Maureen was, oh, I see. Yeah, good catch, Maureen. You can also lose that. You can lose certain moments in your battle with power. But remember, everything's moment to moment. So if you lost at some point, get right back up on the horse. Attack it. You can do this. Okay, good enough housewife. Good to see you. Jasper Hitchcock, great to see you as well. And Mandy Shruprai. I hope I'm saying that right. I could be getting the name wrong, and I'm sorry about that. Good enough housewife said, the hated therapist. I listened to the Brothers in Arms podcast on this. Well, listen, I guess in some ways this is my revenge. I talk about him very freely whenever I want. And believe me, he earned it. So thank you for listening to that. The Brothers in Arms podcast, it's one of my favorite shows. Edgar and Eric and I have really bonded, and now Rob has come in later. I don't think he was in that episode. But it's a chance for us to be really real with each other and support each other. And I've gotten more support from those guys than I did from some of my own friends who just didn't get into it as much with me in the way that Edgar and Eric have. So I highly recommend it. But, you know, of course, I'm a little biased, but I got good taste too, I think. Okay, so Whitney was saying I had to do it quickly, the withdrawal, unfortunately. Yeah, I'm going slowly off the benzo, and it's still hard. Yeah. Listen, make little gains, Whitney. Every time you make, let's say you get down to a certain level in the tapering and then it evens out, well, you won that battle. Then go win the next one. So it's hard, but it can be done. work on it moment by moment. That's what I did. I just concentrated on getting to the next level, getting down another level, and then you were in a better spot. Okay. Pine Lopez, or it might be Penelope. I don't actually know, but hi, good to see you. Okay, Maureen says, me too. No one talked to me that I've had to learn it or learning it now. She's talking about being fiercely in your own corner. It's just such a different thing. And it's not the way we've talked in society, but in my book, you'll see it features heavily, because what I want to do is teach our kids to be powerful and to not have this conflict of power. If we do that, they'll have a lot less doubt, they'll have a lot less symptoms, and they will be powerful and happier. And that's what we want to do. Okay, Michelle said, you're the first person who has ever told me this. That it means a lot, Michelle, to know that I brought that to you, because I know you need it. I know a lot of other people need it, and you do deserve it 100%. And I'm glad you heard it from me, and I'm glad you took it in and are using it. I know it's not easy, but you're doing a great job, and I'm really proud of you. Okay, Sylvia, good to see you on YouTube. She says, hi, Dan. Do you have any ideas on an action step for recognizing time stress as an emotional trigger? I recognized it yesterday, but still got a full-blown migraine attack, trying not to take medication. And she said, I'm still having a hard time with what to do once I know my emotional triggers. I can see them, but not sure what to do with them. Pain still follows. Okay, let's leave this first one up, and then I'll get to the second one. So, Sylvia, I remember you actually have asked about time stress as an emotional trigger before, which is not to say you shouldn't be asking. Always ask your questions. It's great to ask your questions. But the what that tells me is that we probably only got partially to whatever that doubt was. And time stress can definitely be an emotional trigger. And I also understand you're cycling back to this same question because you want more specifics. And so I'm going to get that to you in a second. But she said, I recognized it yesterday, but I still got a full-blown migraine attack trying not to take medication. So if you recognized it, but still got the attack, what that means is one of two things. Either you did not pinpoint the emotions in as detailed a form as needed to be, or it triggered doubt and fear. And I don't know which it is. So, Sylvia, I'm going to ask you, I want you to think about that just for a second and then come back and answer that. Tell me which you think was the driving factor. But I am going to answer your question also while you're thinking about that. So I do have plenty of ideas on action steps for recognizing time stress, really for anything. But if I'm thinking about time stress, the thing that I'm going to try to do, and this relates to what Michelle was saying and what many of us were saying about being fiercely in your own corner. I don't think you're being fiercely in your own corner if you're giving yourself time stress. And I'm not saying that critically, not at all. I totally understand. But if you're giving yourself time stress, think about it this way. In a way, you are saying to yourself, I am less important than whatever this time boundary is. And that is never the case. Never. If you were trying to be there on time or finish something on time, then you've done your job. And if you're really going to value yourself, and this is very much power column work, which is interesting. As I said, I'm not sure whether it's the emotions column or doubt column that's driving this, but the solution to me lies in the power column. Find a way to value you. Be fiercely in your own corner, and you basically can tell time to stick it where the sun don't shine. I don't care what the time boundary is. You are worth more than whatever that time boundary is. And anyone who cares about you will understand. So let's take that as an example and see how that plays out for you, Sylvia. Let me know what you think. All right. Molly says, I did not have withdrawal from tapering off of Prozac, but for me, Zoloft was horrid. Okay. So people can have different responses to different medications. Different medications interact differently with different bodies, but also the circumstances of that withdrawal or the tapering off can be different. Maybe there was more doubt then, or more of some kind of emotional experience. And it also could just be that medication had a bigger effect, which then led to a bigger trigger. But if you taper very, very slowly, I tapered so slowly. This was Lexapro that I was dealing with, and I tapered super, super slowly. Like I went down maybe 0.125 milligrams, which is very small when it comes to Lexapro. And I did it like over a 2-week period. And I just wouldn't mess with anything more than that. Listen, when you're dealing with a trigger, do what is manageable for you. Even if you're taking it like super slowly and it takes you 6 months to do, I don't care as long as you get it done in the way that works for you and in a way that doesn't put you through hell. So try to be kind to yourself about it. Okay. Maureen said, I need to write that on a banner. Maureen, I think it might have been about being fiercely in your own corner, but I'm not sure what you're referring to. But if it works for you, write it on the banner and use it. Write down these things, and if they help you, that's great. Okay, Whitney said, I got off the SSRI very quickly, almost cold turkey. It's been 3 months. Hard to know, is the withdrawal still lasting that long? Okay, this I can tell you. I mean, I can tell you lots of things, but what I mean by that is this is a medical thing that I can tell you anyway, because I know enough about it. It's out of your system. After 3 months, no, it's not there. So the withdrawal is not still doing that. If you are off of all of it after 3 months, I can't necessarily speak to benzos because they can go in a different way that I know less about. With SSRIs, I know that's not the case after 3 months. That's a hard no. That's not causing the withdrawal anymore. So hope that's helpful, Whitney. Let me know. Maureen said, especially women, I think that was about the fiercely in your own corner comment, but now she says about the banner, what she meant is moment to moment, like you're still in control. So yes, listen, I mean, you couldn't pick two better banners to go with than fiercely in your own corner and moment to moment. They're both ones to hold on to all of the time. Incredibly important. Moment to moment is so important with all three columns, and fiercely in your own corner. Listen, I say to live in the power column. So these are great things to tattoo wherever you need to or have a banner. All right. Let's see. Good Enough Housewife said, I don't know why that one small sentence is so epic. That will be my goal this year. I don't remember which sentence I said. It's funny. I say a lot of stuff, but I'm glad it was epic and I'm glad it was helpful. Let me go back and see if I can jog my memory about what we were talking about the hated therapist. Is that what we were talking about? Maybe it was, tell me what you were referring to, Good Enough Housewife, and I will get back to you on that. I'm glad it was helpful, but I want to know what it was. So please do let me know. Okay. Dorisa said, although I have had my COVID booster shot and did become a little achy, didn't know if it was from the shot or not being on my RA medicine. Okay. So listen, the COVID shots and the booster shots, they have been pretty notoriously strong with triggering. I see. It looks like Maureen thinks Good Enough Housewife is referring to fiercely in your own corner. It's so funny. But I say so much and it moves so fast. There, fiercely in your own corner. That is what it's about. Listen, it is epic. There's nothing you can do better for yourself than that. To see that you actually are worthy of being treated like a good, normal, decent human being. You haven't done anything wrong. And anybody who tells you otherwise, you can send them where the sun doesn't shine too. Don't send them there, but tell them to stick it there. All right. So Dorisa, back to the COVID booster stuff. These are very strong triggers, and I did videos on these. We actually haven't put out the booster video that I did. I know you guys saw my second vaccine. I did a video on that to track the triggers. And it's just interesting. Listen, anything we do can lead to lots of triggers. Okay. Now, Sylvia said it was probably doubt and fear about the time triggers, I think. In this case, in the headache she got from it. In this case, I just got stressed trying to schedule a haircut. Not sure if that's quite the same as time stress, but that's what it was. But I did start going through the whole questioning if I should take medication or not. So I think that's why it was doubt/fear. The triggers seemed pretty clear to me. Yeah, listen, to me, Sylvia, something activated you in that emotions column, and it got you going. Whatever it was. It could have been about deserving things. Could have been about being fiercely in your own corner, about being valid. I mean, you'd be surprised. Little things can lead to big, big feelings. So don't discount that. I think there was something big going on from a medical standpoint. From an emotion standpoint. I I read a word from a different comment, from an emotional standpoint. But then doubt and fear took over. And when that happened, yes, if you find yourself thinking, oh, I got to take medication to do this, you're very much in doubt and fear. I don't blame it at all. But Maureen's noting onset and uptick is emotions. Yes. So that onset of the symptom was definitely emotionally driven. Something was going on there. But doubt can take over so fast. All right. Dorisa says, love moment to moment always helps me. It's a huge one. And I'm glad it helps, Dorisa. Fantastic. Now, Molly Miniature says, go watch Nightmare Before Christmas. It came out over 24 years ago. It is time. It's really true. Man, 24 years. I can't believe it's been. Oh, actually, it's 28 years. My God. I got to get on it. Listen, it's not as bad as my aunt and uncle who I made watch The Karate Kid for the first time last year. That was just too much. But Nightmare Before Christmas, I'm on it. It's majorly up there on the list. Catherine Toomer says, I will second that support for the idea that we are moment-to-moment creatures. Very occasionally, remembering that takes my pain away instantly. Fantastic. That's just wonderful that you get that relief, Catherine. And it's also nice when we talk about these things, because every time you guys share a struggle or a success, we're all in it together. We're all trying to understand the columns, and these are ways to do it. So the fact that helps you, that's fantastic. And that's really what your system within my system is. It's a collection of the things that work for you within that column structure that can organize it. So let me just give one more shout out to my seminars and group memberships, because they are really major ways that you can do the work. If you're feeling really overwhelmed by all of the things that you have to deal with in the mind-body community and sorting out what's what, seminars are great for that. They condense it all into a system that is designed to get you to stop having to look for anything else, to feel really confident that you've got what you needed. And you don't need to wait for the seminar if you can't or don't want to. They're available on video. If you email me, dan@crushingdoubt.org, I can get that to you. Or actually, even better, you can email greg@crushingdoubt.org. Most of you know Greg that have interacted in this community. He is the one who does all the technical stuff, and so he's the direct route to that. So go straight to him. But certainly come to me if you need to. The seminars are great for that. The group memberships, meanwhile, are especially good with moment-to-moment work. That's one of the reasons that came to mind as we were thinking about this and how moment-to-moment helps people. Well, in the groups, we get into a moment. And it may be that some people on the group don't actually end up talking about their thing. They're more listening. But we're going through moments, and they could be your moment or they could be somebody else's moment. But the fact is, it is giving you a chance to consider what's happening now and to analyze it from a columns perspective, where we first look at, okay, are you in trauma that's making you not able to use the column so well, which is essentially zero power? Or if you're not, which column is the predominant one? And then what's the broad theme within the column? And then what's the specific thing? And then what's the action step? It's like an assembly line almost. I've gotten very good at looking at these things and knowing how to help people look at them so we can look at each moment and understand what's going on. Okay, Jess Zott has joined on Instagram. Good to see you here. Thank you so much for joining me, everybody. We're going to stop in a minute. But I wanted to say a couple things. One, again, Happy New Year to you all. Two, I wanted to thank everybody. And there's a reason that I thank everybody. Now, of course, if it weren't for you, I don't have an audience. But, it's great that I do have an audience, because obviously we are doing something here. We're really working towards things. But the reason I want to thank you is that you guys do a great job of supporting each other. Some communities don't have that as much, but we're really good about that. We're a kind community that looks out for each other. But there's another reason I want to thank you. And that is that your questions are part of how this system was built. Some of these questions came from me, but some of them came from you. And I have it happen all the time. That you guys bring up a question, I'm like, oh, I hadn't thought about it that way. I need to have an answer to that. Why do I need to have an answer to that? Because the whole idea of the system is for the whole thing to make sense. If it doesn't make sense, how are we going to help you? We've got to be able to make sense of these things. EMC9454 has just joined. Good to see you on Instagram. And Teresa, one last comment, and then we'll wrap up here. She says, The other thing that is good about moment-to-moment thinking, I now recognize that the next day is a new day and moment. Yes, you are never stuck anywhere. It's always changing, and sometimes people get frustrated about it, but actually that's good news. You're never stuck anywhere. And if you have a system that can make sense of the moments, you're good to go. So we're going to keep working on it. You guys keep up the good progress. I'm proud of you all. Thanks so much for joining me. Once again, as always, I will be here on Mondays, 6 p.m. Eastern, 3 p.m. Pacific. And email me if you need to at dan@crushingdoubt.org for any of these things. I'm here to get you the help you need. Let's get you those answers. The columns make sense. Your symptoms make sense. And you make sense. And it's time for you to be fiercely in your own corner. That's the theme of the day. All right. Thanks, guys. I will see you next week. Take care.